I can taste you. I can taste you. I can taste you. I can taste you.
Hey everyone, so I'm at my dentist's office. I just got my crown put in. I'm super happy, and I got my dentists, which are amazing, Dr. Zimmerman and Dr. Krayniy, to answer a lot of your questions that you put on Instagram. So here they are. And let's start with one that I think everybody's talking about, which is COVID, right? So I know it must be like really difficult to deal with patients when when there's COVID, they don't have masks. How are you guys dealing with the situation?
In New York, people have always been very concerned. Our patients are always been concerned about having a clean and sterile environment. So we've always done that, but we have done certain things that are, since COVID, we've put up barriers for the front desk. We do something now besides the usual sterilization. We also have medical grade purifiers in every operatory and in the waiting room to the air that's recirculated is purified and gone through several filtering systems. We do that for our patients. We don't allow anyone in here without a mask. They can only, obviously they have to take it off in the treatment room, which puts us at risk, which is why we now, we wear higher grade masks, we wear shields. Our hygienists like to put coverings on their heads so they can strip down when they leave. And we do everything possible because we are an essential service.
So people ask me what are the reasons why adults lose their teeth?
To answer that question, that the tooth is a strongest structure of our bodies, right? So it's supposed to outlast us. It's supposed to last the whole life. So when something breaks, it's obviously something is wrong. And what I see a lot of time, it's the lack of hygiene, right? So how the cavity starts. So it's the diet, right? What we are consuming, right? High sugar, lack of diet, and that's a start of the cavity, and also a fear of the dentist, not going to the dentist, right? Not having those regular 6 months checkups, right? Which is very important.
People are clenching and grinding like crazy, which puts their teeth at high risk of fractures. So we're seeing a lot more fractures during these very high stress periods too. So it's sort of hygiene, diet, and stress that contribute.
But also bad dentists, right? Because for example, my tooth fractured and I go to the dentist constantly, but they didn't do x-rays before. I mentioned my cavity and they didn't do anything about my cavity. So I think that something that people should take out of this is that they have to go to quality dentists, right? Like they have to make sure that they are going to somebody that's good. They're not getting x-rays, that they should know that these things are like regular things they have to do, right?
Yes, yeah, absolutely. So again, the regular checkups, a good healthy lifestyle, and then a positive attitude. It's always
So a lot of people are curious about teeth whitening, right? Because everybody wants to have white teeth, and a lot of people hear theories that it can really hurt your teeth, not really do anything. Do you guys recommend any products? Do you think it's healthy to get your teeth whitened? Do you guys do teeth whitening here?
Right. I would say that teeth whitening is a very good and safe and easy procedure, right? So it's a very quick cosmetic enhancement, right, of your smile. And most of those products are, I will not recommend any particular product, I don't think it's very ethical, but there is two big groups. One is in-office whitening and one is that you can buy over-the-counter one, right? So in my opinion, that the whitening in office, it's always more effective in a way that it's done by professional, it's done right here on the spot. It takes 1 hour and you don't have to do anything at home. Can you get similar results doing everything at home? Yes. but it takes 10 days, 14 days, every day do that procedure. Who has a time discipline,
Right,
you know, to
right.
do it? I feel like in-office whitening is definitely
Always
works
effective.
more effective. And you can always follow up, you know, with those at-home products once a month, twice a month, because again, it's a very safe and effective way of enhance your
Yes.
smile.
They told me that you can't really whiten your teeth in the office regularly because it actually could deteriorate your teeth. Is that
No,
a myth?
That's not true, but it's been tested for every 2 years. We're actually able to whiten even for pregnant women. You know, if they can do it for a pregnant woman, it's pretty safe.
Right.
Because,
Okay.
you know, if anything goes wrong with a pregnant woman, it's big bucks, you know,
Right.
if something is wrong. But no, it's the way we do it here, and any of the sort of like the opalescence that you do at home, they're safe if they're used properly.
Okay.
And I like the products that are controlled, where you're not putting necessarily the gel, that it's already
Okay.
on there,
Oh, that's
because
good, yeah.
people tend to not necessarily follow instructions as well. That's why I agree with them that it's done the best when it's done here
For sure.
with people who know what they're doing.
For sure. So we're gonna answer one more question, and somebody asked me about Invisalign and like, what's a good price range? I mean, do you think like there's a lot of like other companies coming up now?
Right.
Do you recommend Invisalign? Anything else? Like I did Invisalign and I loved it. So yeah, can you tell us more a little bit
Right,
about it?
Invisalign is the great, it's a great brand. They were the first that invented those clear aligners,
Right.
and there is absolutely right. There is more companies who
Right.
is doing it. There is a Smile Direct Club
Right.
that kind of like do it yourself,
Right.
right?
That's
So
the danger.
Yeah, you don't want to do it yourself.
honestly, yes, yeah, you can maybe try to do your haircut yourself, but I would not do
Not even.
not
Have
even
you
that,
seen the results
right?
of the haircuts? It's
So-
crazy.
We've seen it, you know, during the COVID, right?
Right.
So, but I do Invisalign. We do Invisalign in the office, and I like that company because they have a lot of research behind them. I've seen amazing results, very predictable results, which is very
And safe
important.
results. You know, if you're going to do something, it's not that much of a savings. Maybe at best a couple of $1,000s,
Right.
and you can ruin your teeth for life if you don't do it properly.
Yeah, I mean, if
And-
people paint like color their hair at home and mess up their hair, imagine your teeth. Like, I would,
And
I would never do that.
Nowadays, you know, Invisalign have a lot of different lines of the products, right?
Right.
It depends, you know, if it's an express case or comprehensive case. There is a lot of in-between products, so there is a big price range as well. It can fit any budget, I would say, right? So, and it's a very competitive and a good product that we love.
Right.
You know, honestly,
And we trust.
well, as you guys can see, I have been very lucky to find amazing doctors. I recommend them very much. If you're in the New York, New Jersey area, this is where you have to be because it's hard to find a good doctor. And once you do, you want to never let them go. And maybe I'll share them with all of you. Thank you
for
so
the kind
much.
words.
Thank you for helping me out, answer my followers' questions, and yeah, see you next time.